Hello, my name is Amy Sturkey. I am a pediatric physical therapist, and I am here with the Mykael, not a Mykael, but the Mykael. He is 7 years old. He's a toe walker. His grandfather's a toe walker. His uncle's a toe walker. It runs in his family, and we're working on activities to help stretch out his heel cords today. And so I'm using, since I usually use a wall, but I don't have a wall here, so we're using this step stool. Can you put your hands on there and put one foot back for me? All right. One of the things I try to make sure is that this foot is straight onto the wall or whatever it is. Perfect. And to make this stretch better, because I've done a video of this before, but I've never, ever done a video with the rolling pin. So one of the ways I make this stretch more effective is I start rolling the calf muscle. I love how he's got a little bit of a bend in his knee, so we're getting both soleus and his gastrocnemius. Nicely done. This can be really uncomfortable. I'm sure he's crying now, so try not to be mad at me. I try to do the medial side of the gastrocnemius and the lateral side. And it just makes,
this is painful.
It's what?
I said there's no way this is painful.
Okay, it's not painful to Mykael because this is Mykael. At home, if your kid is crying, I understand. So now that you're in terrible pain.
I am still not.
What? Okay, well, he's not in pain, but I would usually do this at a timer for 30 seconds to a minute at a time to try to get a really effective stretch. I hope this rolling pin idea is an idea that can make your stretch at the wall more effective, and we'll look forward to seeing you next time. Are you sure you're not crying?
I'm sure.
Okay, thanks. Bye-bye!
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.